Hi there, this is Dr. Paul and thanks for tuning in to yet another video from Waterfront Dentistry by Paul's. We have Dr. Hearn again in my chair, and today we're doing a crown for him on his tooth, his upper left tooth, and that right there is the tooth in question. It's a tooth that has a bigger filling on it, it has some leakage around, and the reason why we need to put a crown on a tooth like this is white fillings have a certain amount of lifespan on them, and usually if you have leakage around fillings in the long run, you're also higher prone to needing a root canal treatment, which is painful, and after that you need a crown regardless. So we're trying to cut the middleman out, which is a root canal treatment, and just put a crown in there. Dr. Hearn, any words?
Yeah, 5 years ago I never would have considered a cap on a tooth like this, just because the materials we used were quite hard on the tooth. With the newer materials, we're seeing pretty good margins and good strength with minimum tooth reduction, so it becomes a possible option, and it's really a new material that's just come out in the last couple of years.
Correct. So like Dr. Hearn said, back then materials needed to be certainly thicker to be stronger, but these days with new technology, they can give you the same amount of strength even though they're thinner, which means you're encroaching the nerve space lesser, and hence the tooth can last longer with more girth underneath the crown. So it's kind of physics, but long story short, capping your tooth these days to prevent large fillings from leaking and you needing root canals is the way to go. So we'll take a little video after the procedure with a couple of words from Dr. Hearn about his entire experience, and yeah, we'll take it from there. Thanks for watching. Hi there, this is Dr. Paul again after our procedure with Dr. Hearn. What we did is we did a crown preparation on one of the tooth with a big filling like I showed you previously. The tooth in front of that tooth had a small cavity which we slowly fixed because that area was open once the crown prep was done, and the tooth behind, which had a big silver filling, we replaced that with a white filling. So anyways, you can see all these photos. I'll be posting them along this video for you to have a look at. Dr. Hearn, any thoughts?
Well, you know what's kind of interesting is that x-rays actually do not show everything.
Correct.
And in fact, an x-ray only shows about 60% of the damage at the best of times. So when we are operating on a tooth, it's not uncommon to find things that didn't show up in the x-ray.
That's right. Yeah. So when we first saw the x-ray, there's two kinds of x-rays. One is the one that shows a cavity detecting x-ray, and the other one shows you if you have any pathologies or infections along the entire length of the tooth. So when you look at both of them, sometimes you don't actually see if there is decay underneath, because an x-ray is only 60% sensitive, like Dr. Hearn said. But once you open stuff up, you actually clinically see a lesion there, and of course when you see something you got to fix it, and that's exactly what we did. So anyways, thank you for watching this video, and if you ever have doubts if crowns or bridges or even fillings are something that you need, or if you have any sensitive areas on your teeth and you want to look us up, and we'd be glad to help. Thanks for watching. Bye-bye.